The color Doppler is a non-invasive method to investigate the venous and arterial vessels of the ocular bulb, permitting an accurate and reproducible measurement of the flow velocity and resistive index. The venous and arterial vascularization within the orbital cone are here visible on an axial plane. The ophthalmic artery, which is the first collateral branch after the internal carotid siphon, runs coaxially with the optic nerve. It branches at first, giving the central artery of the retina, and then crosses the optic nerve and continues toward the medial part of the eye, where it branches, giving the posterior ciliary arteries. CT as well as MRI visualize the anatomy of the ophthalmic artery at the inlet of the orbital cone and when it crosses the optic nerve. Sine Tensione glaucoma is defined as the presence of papillary excavation combined with perimetric damage in subjects with normal intraocular tone, lower than 20 millimeters of mercury. Reason for neural loss causing visual defect in this syndrome is still unknown. Among possibilities could be involved connectival defect of the lamina cribrosa or a hypothetic ischemic damage. Aim of the study is to evaluate by color Doppler imaging the presence and the entity of blood flow changes within retrobulbar vessels such as ophthalmic artery and posterolateral ciliary artery. The main purpose of our trial is the acquisition of data concerning the pathogenetic mechanism of STG, which is yet debated. 15 patients, 11 males and 4 females, age range 20 to 61 years, affected by STG entered the study. After informed consent, we evaluated by CDI the systolic peak, time average velocity, and resistive index in ophthalmic artery and posterolateral ciliary artery. Statistic analysis of data was performed by using t-student test with significance for p less than 0.05. In our study, we use a US apparatus Isaote AU4 IDEA with pulsed wave Doppler, color Doppler, and power Doppler. We used a 6.5 MHz microconvex probe and a 7.5 MHz linear probe. Patients were examined in supine with the eye rotated in order to obtain the best signal. This is the sampling of the ophthalmic artery in a STG patient. This is the sampling of a normal ophthalmic artery. This is the sampling of the posterolateral ciliary artery. In our series, the CDI analysis seems to confirm the ischemic pathogenetic hypothesis, which is related to a decrease of the systolic peak velocity and an increase of the resistive index in the ophthalmic artery. In the posterolateral ciliary arteries, we observed similar findings, although with a more evident statistical significance. Our experience leads us to believe that both neuropathy and perimetric damages in STG are due to a flow failure in the posterolateral ciliary arteries. These vessels feed the head of the optic nerve, and a marked decrease in their blood flow may jeopardize the optic nerve functionality.